Hi there, my name is Jacob Ewell, and I'm a nurse practitioner student with Weber State University. And I'm currently working on my doctorate of nursing practice, and I've been working on a project with Comagine Health. So thank you for participating in this meeting today, and I'm grateful that I have the opportunity to meet with your council and to discuss this project with you to hopefully help benefit patients and healthcare providers throughout Utah. So, as I mentioned, I teamed up with Comagine Health to create and improve hypertension or high blood pressure resources. And I also helped to develop a guide for the improvement of self-measured blood pressure. You'll hear me refer to that throughout this presentation as SMBP. So, the Million Hearts campaign identified that providers and clinics in Utah needed more information to develop and implement SMBP programs and needed additional educational resources to educate their patients on hypertension. So what's included in this guide that I've created? The guide includes educational packets in both Spanish and English that is comprised of information that discusses what is hypertension, how do you treat it, and lifestyle changes necessary to improve blood pressure. The guide includes a packet specifically on SMBP monitoring and the necessary steps to self-monitor from home and effectively communicate this information with your provider. It also includes a packet for your healthcare provider to for better access to treatment guides and resources that will eventually help patients. In the guide, you'll see QR codes directing you to separate resources and videos that will help you better understand the contents of the guide. And to access a QR code, I'm not sure if you guys are familiar with QR codes, but to access a QR code, you open your cell phone, you go to your camera application, you hover over with the camera over the QR code that's on the screen, and then you'll see like the border of the QR code that'll light up. And then after that, you can tap the little icon that'll drop down once it recognizes that it is a QR code. And that'll take you to the website, the video, or the handout that's attached to that QR code. So why is SMBP so important? About half of all Americans have high blood pressure, but only about a fourth of adults with hypertension have that under control. And so that's a pretty significant number of adults that are walking around with high blood pressure. And high blood pressure can increase your risk of developing heart disease, kidney disease, strokes, damage to your eyes, and may even lead to other health complications like dementia. And it's often referred to as a silent killer because most people don't know that they have hypertension. So, and by the time they figure out that they have it, it's too late to prevent the complication that has resulted. So today I'd like to walk you through the SMBP portion of the guide as if you were a patient. And so just for purposes today, I'm just going to say that the patient we're seeing today is Jill. And so I'll walk you through the steps as if Jill were a patient and how the clinic would respond using the SMBP guide. So upon admission to the clinic, the MA or the nurse, depending on what the clinic uses, will take the Jill and take her blood pressure. And if the blood pressure reading is high, that assistant or nurse will take a following blood pressure. And if both of those are high, she'll note that in the electronic health record for the provider to see, or they may just notify the provider directly. It depends on how the clinic communicates. So as the MA or the nurse identifies that, they may ask Jill, do you have high blood pressure? Have you ever been told you have high blood pressure? And they'll just plan on moving forward. So they'll collect the hypertension education packet as well as the blood pressure self-monitoring or SMBP guide. to be available for the patient to take home with them, and for the provider to use if they so desire. And so they'll have that all prepared and give it to the provider prior to the provider entering that room to talk with Jill. As Jill sits in the office, the provider will come in, discuss whatever she's there for that day, but then may also approach her high blood pressure and educate her on the treatments for high blood pressure, why it's important to get it under control, and just discuss those blood pressure values with them. And then from there, they can create an effective plan to help lower her blood pressure in the coming weeks. And like I said, the hypertension packet education and the blood pressure self-monitoring guide will be available for that provider in that appointment. If Jill would like to continue with blood pressure self-monitoring, then the provider would notify the nurse or the medical assistant, and they would come in and sit down with Jill and explain what self-monitoring is, and demonstrate for her the necessary steps for her to do it from home. And some of those steps include, she's going to have to first obtain a blood pressure cuff to use at home. There's a list of validated blood pressure cuffs that work. And then she'll be educated on how to take her blood pressure correctly, measuring her arm to make sure that she buys the correct blood pressure cuff. Some clinics, although not all of them, may have blood pressure loaner programs available to give that patient the opportunity to borrow one for a couple of weeks, but that'll kind of be case by case depending on that clinic and what they have the capability of doing. So yeah, they'll do a full presentation for Jill, show her how to measure blood pressure, and then also walk her through the hypertension education packet if the provider hasn't already had the opportunity to do so. Then they'll answer any other questions that Jill may have, and then instruct her on how to report her blood pressure values to the clinic. And so again, this may vary from clinic to clinic, but the general idea is that they go home, the patient records on a specific sheet their blood pressure values. They're going to want to take one in the morning and one in the evening and write those down. And then after about a week or so of data, they'll call the clinic. The clinic will call them, and that clinic will be able to say, okay, thanks for your numbers. Have you been taking your medications? Have a good conversation with them. And really, the call to follow up with the patient is an opportunity for the clinic to really develop a relationship with that patient and make sure that we're identifying ways that we can help improve their blood pressure. And so that follow-up will happen within 2 to 4 weeks of the initial encounter, and then they'll follow up weekly with those values until the patient is at an adequate controlled blood pressure. Once the patient has a blood pressure that's well controlled, then we can just move follow-up visits to every 3 to 6 months, and ultimately hoping that we can control that patient's blood pressure, and they can be aware if their numbers start to creep up. Okay, maybe I need to talk to my provider again. Let's make some adjustments. So that's kind of the flow for the SMBP guide. It explains step by step in the SMBP guide. I'll run you guys through that really quickly here, just to kind of show you what's included in there. So let me just share my screen, and okay, so hopefully you guys can all see that there. Okay, so you have your self-measured self-monitoring guide here, and I'm just going to kind of run through the table of contents. So first, you have an introduction on what is SMBP, It's a great video. It's very direct, explains exactly what it is, as well as some other flyers and handouts that they can use. And then what do I need to self-monitor? So you've got, how you can find those validated blood pressure cuffs, and then choosing the correct size, as I kind of outlined before. And then beyond that, there's instructions on how to measure your blood pressure, and then instructional handouts for correct technique to take your blood pressure. And then at the end are the blood pressure logs, where they can record their daily blood pressure values. And so that's kind of just outlined in the guide. And like I said, these are the QR codes that I discussed, that you'll be able to hover over. It'll take you to an external link. So that's the hypertension, or the blood pressure self-monitoring guide. The hypertension education packet, some of the things included in that packet are introduction videos about what high blood pressure is, includes multiple handouts that include consequences of high blood pressure, and then high blood pressure as it relates to strokes and heart disease. How you can improve your blood pressure. So lots of different things can be done to improve blood pressure besides medications, such as, increasing physical activity, eating a healthy diet. Inside of eating a healthy diet, there's lots of links that I've provided for easy ways to make healthy recipes. And then lots of government websites specific to that. Why I should reduce sodium, how to take your blood pressure medications and make sure you adhere to those, and then video tips on taking, and then there's further guides on African Americans and high blood pressure. African Americans are at increased risk, and some medications don't work as well for African Americans. So that'll be important for people of that background to be aware of. And then how do I measure my blood pressure correctly was also included in this packet. So those are some of the resources that I've created or put together for patients and providers to better control their blood pressure. And I've been really had a great opportunity working with CoMagine Health here, and I hope that this resource can be used by patients and providers throughout Utah. My hope is that this project will empower providers and patients to actively manage their blood pressure through improved educational resources and personal involvement in hypertension management. The ultimate goal of which is to prevent adverse health problems and improve lifelong outcomes. Thank you for your time and support. Rebecca Wilson will be able to answer any further questions you might have. Please review the guide, and in a few days you'll receive a link for a post survey. I would greatly appreciate it if you would review the guide and provide feedback through the survey. I really appreciate your guys' time. Thank you so much for watching this video and being a part of this amazing project. So thank you very much.